Hello, and welcome to another podcast from Care at Scale. My name is Greg Greeners, and I have the pleasure of welcoming my guest today.
Hi.
We have the opportunity to walk through her story, which is Stefaniya's story. This is the part that we're really going to get into, and what a story it is, and what a story you have to tell from basically coming to the States and how we're going to walk into the podcast scenario, which is Care at Scale. And one would say, well, how are all these things going to tie together? She is the founder in the organization that is working to help others with software that will work with payables and other patients and physicians and so on. I always like to start with literally when you're younger and how you go from being outside the United States to end up coming to the United States. So why don't we start with that conversation?
Yeah, sure. Yeah, my story starts in Belarus, where I grew up. I actually grew up around healthcare because my parents owned a practice there. And I also was very curious about life, loved to travel, and also wanted to really go to school outside of the country.
Mm-hmm.
And actually, my story also involves a little bit of the stay in Czech Republic. But later, I wanted something at a grander scale, and that, of course, brought up that American dream in the US into place. So I moved here for school, and there were a lot of things that I had to learn about, and one of them was healthcare and how much different it was from something that I'm used to, from that universal healthcare that you have in Belarus, or those straightforward processes that you have in the private practice industry there, where you get the quote, you pay, you get the treatment, and it kind of ends there. Here, I had to learn all of those new terms like deductible, maximum, co-insurance, and stuff like that. And I got really shocked about how much insurance is shaping the way the care is. So yeah, with all that, and also like entrepreneurial and the mind and the curiosity that I had inside, that made me like dig into that space more.
Well, you kind of jumped right over the fact that you kind of had some family involved in healthcare. What was their specialty? What were they practicing? Was it just general practice, or was it something more specific?
It was dental practice.
So you knew what it was like to be within a practice of providing healthcare.
Yeah. So first of all, I was even surprised. You should be paying for healthcare in general, especially for dentists, and it's hard to find a good dentist here.
It is.
Yeah. And then, I was involved in a lot of the processes. I did really enjoy spending my free time at my parents' workplace and seeing how this is all operated. And then when I grew a little older, I would help with some of the things on front desk, or doing some of the assistant job there, like on the lighter scale. So,
well, I believe that situations like that really build the foundational part of what you become very interested in later in life. And although you just quickly walked over the fact of I was at the front desk, or that's a big deal, because in the States in particular, what you just referenced is what happens at the front desk with the patient interaction can make or break the success here in the States, which goes down to insurance. We'll get to that in a minute. But the fact that you have that as a background and you understand the workflow, the patient flow, and then this is the other part I was going to ask you about, even though medicine's very different there, how physicians are impacted by commercial payers, private payers, and so on. But where you grew up, they were just part of the system, correct?
Right. So there is a lot unity there in how the processes are. And also it is very clear in the way it operates. There is government, and there are governmental institutions and hospitals, and this is all free, kind of, if we don't consider other processes. But if you want to get something extra, there are private practices, but they're also very clear in the way they are. So there is pretty much no insurance, or it operates also differently, where it's just you having a consult with a doctor, then getting the treatment plan, and basically getting the treatment. That's it. There are no more complications. So everything that I saw later really flipped my world. It was so much different. And like so many more players and them all having like all those sorts of monetary incentives and other incentives that I couldn't even imagine could have existed. Because, yeah, there as a patient or as a doctor, you're also very confident in what you're getting. If the patient needs this care, you just negotiate kind of the terms with them, unless it works. And that's it. Everyone knows what they're getting from that appointment. It's not that you find out years later and you get surprised even more of like you not expecting it not to end where you had, checked out from the practice. So,
well, the interesting thing about dentistry in the States, which you've probably learned at this point, they're one of the few specialties that opted out of many of the managed care plans. So it's one of the reasons we have different dental insurance that's an add-on to your typical insurance policy, because they get paid differently and they get paid a lot more for the ancillary services they are participating in, and it costs us more as the patient. Yeah,
if we get into the pricing point also, like of how much prices are higher here than there for the same type of treatment, and also like even same type of materials, because many of them are kind of just the standard for the industry, and that's it. Yeah, it's surprising.
Dentistry is one of the most shocking, oral surgery and so on, for, I'm sure, when you started looking at the cost compared to what you grew up with. Yeah, big difference.
Big difference. So it doesn't feel right for me in general, but the more I learned about it, the more I understood where it's coming from and why it is the way it is.
Well, and that's where coming to the States and getting your education, one of the first places you started working in was within the healthcare industry, correct?
Right.
And where did that start?
It started within the medical practices. I also have computer science degree, so it was a lot about that software support that I was helping them with, and some of the other part of it. But it made me see a lot of the operational side and interact a lot with the staff, and that really get close with the doctors. So I started learning about the internal processes that I wasn't familiar with as a patient. And another surprise of mine was when I started learning more about from the people who were also the insiders in the scene, is that I thought that I'm so confused just because I'm the patient. And when I talked to them, I realized it's not just me not being born here and familiar with the system from like my young years, but it's just anyone I interact with. It's just the same.
Unfortunately, you're correct. It doesn't matter your age, where you're from. It's all complicated. And certain payers, you have to go through 3 times to go for a payment. I mean, it's the protocols that they put in place to make it more difficult for you to receive what you're already paying for, is part of the broken system, for sure. Well, somewhere between there and Sphere, which is the company that you founded, there was this break point of, I think I'm going to take my degree, I'm going to take my background, and I'm going to put it all together. And so where did that all come together?
You're right. There are so many factors that came into place to shape it. And one was that I started interacting with more and more practices. So it wasn't only the ones that I was working with directly. I was talking to the ones that they referred me to, or like just more people in the industry. And I realized it is a common problem among them all. And then I also met my co-founder, who also worked in the field and then dealt with a lot of similar things that I was. So throughout of our conversations, we saw that there is that problem. We have the technical knowledge and capacity of seeing how this could be all addressed with the technology, but also how to make it native to the workflow so that people whom we work with and like interact with on a daily basis also can adapt to it and like find the use out of it. So that all just felt like a very good idea of us really being involved and feeling the pain, and also feeling that we do have the skill to step in and solve it.
And so which specialties were you working for when you
I was
first...
also in the pain management, radiology. I did work with dentists as well. So some of the things that, in the way that they operate differently, I also was very lucky to learn. So that were the practices that we started initially to build for.
And being able to have a couple different experiences in different fields was part of what I imagine how you decided that you're going to found Sphere. Right? Working with different organizations, and there's more to be had out there. So kind of explain to me that leap point where all of a sudden you and your other co-founder decided that it's time to rework what is considered the norm because it's broken.
The leap point was me spending a couple of years in my role, and then also starting exploring new opportunities that are out there, and feeling that now there is a lot more that you can do with the technology. And also throughout the conversations, I felt that doctors who are really very conservative now are also a lot more open to adapting something new in their workflow. So that was the point. I thought that we should start now.
Well, you were working with these professionals and they were constantly explaining to you how it wasn't working specifically for them. And I'm guessing you heard that over and over again. And now you can go help them. You can help them streamline their process and how they go about it, which is part of my next question. Explain to me more about Sphere. What does Sphere do? How does it work? Why would someone want to participate in Sphere as a result of what you kind of just described?
At Sphere, we are building the intelligence layer between the insurances and the providers that can give them that leverage that usually only the larger institutions have. So it's basically simplifying all of the operations from the point that they get the inquiry from the patient to the moment when they're getting paid by the insurance for the treatment.
And you just nonchalantly walk through that, but that is a pain point for all parties involved, whether it be the physician, whether it be the patient. And now you're going to allow for this operationally to be much cleaner, but equally important that the patient has, I would guess, some more transparency as well as the physician, correct?
Right. So the more transparency the doctor has out there, the more options he can offer to the patient, the more data he's operating with, the more leverage they have and the more clarity they have on the treatment plan. So they can all openly discuss it with the patient, figure out what is the path they're taking. And it definitely benefits both the provider themselves and the patient who is not getting the surprise bill because they were aware of those policies, of the complications that might happen, of some of the fees that the insurance is offering. Because now many times the patient sees or like talks to their insurance and they would say that the treatment is covered, but they don't explain what really covered means. It doesn't really say that they're paying for anything or that there wouldn't be a complication with the documentation they need to submit. It's just the word that they don't take any responsibility for, kind of. So what we do, we help them, both of the parties, understand what actually is the meaning that is laying under the words that they are saying.
And the verbiage that they use and the words that they use are part of the translation problem, because they don't necessarily understand what they're receiving or not getting. So if there's someone in there to help translate what that's doing, I assume that's where Sphere is putting themselves in that middle ground to work for both the physician as well as the patient to some extent.
Right. So that's pretty much what we do, but also helping with on all the underlying processes on the way as well, so that they simply don't have to spend most of their day on figuring out all that paperwork.
And how is it being received by the physicians?
It's really being received well. We do see a lot of impact, especially in those specialty practices that I mentioned that have to submit a lot of documentation, do need a lot of authorizations, and who really spend a lot of time on calls with the insurances when they need to figure out any of the coverage. So for them, instead of like 2 hours, it becomes 5 minutes. And they do really appreciate it. And later also, they don't need to follow up for, their claims that have been submitted. It's all being taken care of automatically. And it does improve a lot in the workflow.
And workflow is time. And time is what they call cost. And now we're limiting all of those things and putting better processes in place. So I can only fathom how the practices are appreciating it as well as all the staff. So the practice size, I'm guessing that the smaller practices are really more appreciative to this system having Sphere?
You're right. We are working mostly with the smaller practices, like 5 to 10 providers, but solo practices work with us as well. And those are the ones that don't have the whole department dedicated to solving just like one sort of task out there. They're multitasking. They do value their time a lot. And they don't have the budget for the infrastructure, that usually only the hospitals can afford. So with that, they're just, with us, they're paying for what they're getting, what they're using. So in these terms, it's much more efficient for them than like sometimes dealing with it only after the fact that they like a denied claim and stuff. So it's very easy, user-friendly, and could be used by both the provider who, for example, wanted to bill the claim themselves, or the practice staff could learn how this is run very easily. So just anyone, but we mostly want to build it for the smaller practices that don't have the access to the budgets or to the means that only like the large players have.
Well, these days you either have the large groups or you have the small groups. Like there's not a lot of in between. So the smaller practices that are looking for resources that can make their scenario more advantageous, which would go back to making sure they're getting paid because the patient has gone through the process to make sure that they're eligible for that payment.
That is so true. And that is also one of the incentives and the points where I thought that, yes, I should transfer my career in this path and also get to be solving the problem, is when I realized how many practices are shutting down or selling out because they just cannot longer afford it to the insurance. And it's such a burden for them that they simply have to switch their career. And I really got that it's something that is happening at scale and like is dropping by 20% since like recent years. So that was another problem.
It is a problem. And this scenario where you're trying to make sure you're getting paid timely, let alone getting paid, but if you're getting paid timely. And so this scenario for Sphere is they're also helping that process, I'm sure, as well, where they're hitting all the marks of the prereqs or pre-auths or any of the pre, so that then they're able to get paid more timely. And if they're able to get paid more timely, then they're not going to go out of business, as you're saying.
Right. And the patient is going to get the treatment timely, which is also very important because many times you have to wait for the response from the insurance for the weeks, and then the patient is not getting the treatment they deserve in that time frame.
Is this transferable to any practice regardless of what type of medicine they're treating, any specialty?
Yeah, that is transferable to any practice, to anyone who is billing the insurance.
If you're willing to take on the battle, as they say, right?
Yeah.
You know that you're doing that. Now, speaking of insurance, is there certain ones that it seems to work better with or more difficult with? I mean, Medicare, Medicaid compared to Cigna, Blue Cross Blue Shield, Aetna, so on. Have you found your, I don't want to say sweet spot because it's all patient based, but where do you find that you work best with it?
It pretty much works with both Medicare, Medicaid, and the commercial insurances. We found that some of the providers are kind of also interested in using it with out-of-network patients. That also gives you a lot more on how this is going to be handled by the insurance. So this is something we can also help them with. So pretty much both, but I see a lot of the interest around the commercial insurances as well.
Makes a lot of sense. That commercial, depending on which payer, they are all uniquely different as opposed to the federal government payers, which is pretty cut and dry for what
Right.
the patient is.
Yeah, that is true. So there are many more rules involved there too.
So you're scaling your business. I imagine Sphere is growing, and you're in the New York City area, which you have only millions of people to try and help out. So what's next for Sphere? What's your goal? What do you hope to make happen in the coming years and future?
We really want it to be more than just the insurance infrastructure. We want it to be the technology that takes out a lot of the operational burden outside of the staff's and providers' hands. So we want it to be the full system that helps you run the practice without needing to spend most of your day on just those bureaucracy and routine things. Also spreading nationwide. It is mostly New York for us now because we are here and we like interacting with the doctors in person and helping them out with the software. But we're growing nationwide, so.
That's awesome. And which specialties are you working with now that you've had good success with?
We are working a lot with pain management practices, and we saw a lot of potential there. Something like radiology, a little bit different in their direction, but also very helpful. Anesthesiology doctors also saw the benefit. And yeah, pretty much any specialty works. But also that were the practices that we built together with from the beginning.
They knew you and they trusted you that you were going to do right by them. And considering it's growing and continues to grow, I think that's pretty awesome. That's pretty awesome that you're sustaining that.
So, and like dentist and vision is also the part of it. So even though the processes are different, but there is a lot that we can help you dig out of what you probably haven't noticed or didn't know before about the practice or the insurance you work with. So
I always like to say at this point that after we've kind of learned a lot about you and what's happening, that this is the foundational block of everything else that will come if we do other podcasts. And there would be I would like to have a conversation where we just pick a certain patient scenario and walk through it and explain it all because it's so difficult, right? And if you're able to explain that to people and why the software for the Sphere side would help the practices and the medical physicians, but it would also open their eyes up for other things that could happen. So it's your story and how we're going to be working through that in the future. And I'm really excited to hear how it continues to grow. So is there anything that we didn't touch on that you wanted to make mention of?
I think that we touched on a lot of stuff, and healthcare is just endless and so complex that we can go on for forever. But the main thing was that I think that I didn't realize how much care is shaped not only by clinicals, but by the insurances. And that is something that I hope can be addressed with the technology and all the combined effort now.
I think it certainly can be. And if someone wanted to get in touch with you, how would they reach out to you other than being in the podcast and be underneath that, which would probably be the easiest way to click, but you can tell me anyway.
The website is available. It's Sphere Int. net, and there you can book a demo. We'll be happy to put you in touch with our team and do the demo, connect with you. So just as easy.
That sounds awesome. So thank you so much for your time and spending some time on Carrot Scale podcast. And we'll have to do it again soon.
Happy to stay in touch and keep you updated.
All righty. We'll talk again. Thank you. Bye-bye.